Sussie the dog is on her second round of parasite medications. We're at the full moon, 3 days after the full moon, so this is her 10th day of her second round of parasite medications. She's on pyrantel, and no, you're not done yet, you're just starting. She's on pyrantel, and the first round we saw lots of worms coming out. This round, I'm understanding we're seeing still worms coming out, but not as many as the first round, but still seeing some come out, so that's good. I understand that the night before the full moon, she was wild with biting and scratch and itching and biting. The night before the full moon, I was actually out of town, so I couldn't come over and test her like I would have liked to when she was having the bad symptoms. So here we are 3 days after the full moon. And her main complaints are diarrhea and still biting, although not as wild as she was the night before the full moon, but she's still biting and scratching. So we're going to test her baseline here. This is about I guess the 5th video we've done with Sussie, so we're just going to go right for it. We've got ivermectin here, protozoan parasites. No. Levamisole, a worm medication. No. Tinda, a protozoan parasite medication. No. Alinea, again protozoans. No. Mebendazole, worm medication. I've got 2 mebendazoles here. Diethyl, a worm medication. Praziquantel, fluke medication. And pyrantel, this is the medication she's on, which is for worms. That's the one she's on, so let's see how she's testing on this one. Not really. Okay, so not interesting. Not really testing well on any parasite medications 3 days after the full moon, which is actually when I'd expect the parasites to kind of die down a little bit. So not testing well on any of those. Let's see what else we've got here. Excuse me, Miss Sussie, let me get your... We wanted to test her again on her food, just to see where she's at on her food. We've got kangaroo. Move stuff around here. We got her kangaroo food, right? That's what this one is.
Yeah,
strong on that one. And this one is, what is this one? The bag?
That's the Hill's Diet DD.
Hill's Diet DD. Okay.
Prescription.
Prescription dog food.
No.
No. Okay. And this is the ZWP grass-fed venison? Venison. Grass-fed venison.
Yes.
Yes. Okay, so these 2 were strong, so let's just compare these 2 and see where we are. Let's do the kangaroo first.
Okay.
And the grass-fed venison.
And that's a little stronger.
A little stronger on the venison. Okay, so but they're both strong. Okay, so we kind of put them in order like this, probably the most strong to the least strong. Okay, and then I've got some. Can you pass me these bottles? I got them too far away from me. Just give me everything there. And, okay, now I've got to go through. I'm going to go through first a couple of drainage remedies. This is the one she's on, bladder terrain. I just want to see if she's still testing well on that one or not. Oh, hold on, my magnet came off. I've got a magnet. I forgot my normal magnet, so I got just a refrigerator magnet taped to my hand here. No. Okay, so she's done with the bladder terrain. I've got gallbladder ND, which she has tested well on in the past, so I pulled that one out. Okay, and we got some Toxex. Again, just if worms are breaking up, it may have released some toxins.
No.
Just guessing in the dark here. Renalex for her kidneys to help her kidneys drain.
Nope.
No. Okay, so she's not testing well on any of these drainage remedies. Then what I'm going to do is I'm going to go through my whole box. I brought the whole box. It's typical that that humans will will need a drainage remedy, I found, for 3 or 4 days, maybe a week, and then they're kind of done with it. They're kind of unstuck, and they don't need it anymore. So I'm just going to go through my whole box of drainage remedies. Actually, this is not even my whole box. I have another box, but these are the terrain remedies, which I find to be the most, usually testing the best. So the most effective, I would say it that way. So I'm just going to go through the whole box with her really quick and just see if we find anything that she's testing well on. I'm not even looking at what they are. I'm not even going to go through what they are. I'm just going to go through the box here. Could be that she's... Just being super patient here, kind of whiz through this whole box. I'm just going to lay down and take a break. Take a break.
Yes.
Okay, this interestingly is gallbladder ND, which we weren't seeing is testing so well before, so I'll just set this aside and we'll look at it again.
That one's stronger too.
Okay. I don't even know what that is, but no. Okay. So I'm gonna get rid of
What's the
this.
second one test on?
I don't know. Let's see. Skin. Back to the skin. She's been on skin before and tested well on skin before, and it's helped her.
Great deal.
Yeah, and we just went through everything from blood to liver to there's everything, pretty much everything in this box as far as the terrains. I think I have literally every single one of them in there. There may have been a couple I had pulled out. Well, the bladder, we already tested that. Let's just test that again. The gallbladder ND, the skin, and the bladder. Let's look at those. Missy, you're not done yet, okay? Let's look at the baseline. Remember where we are, where we're starting.
Yeah.
Skin, okay. Skin.
Yeah, stronger than baseline.
Stronger than baseline, stronger than skin, or not
No.
sure? Okay, skin, gallbladder ND. Not really. Okay, not really on the bladder. I'm going to go for this big bottle of gallbladder ND and just see. I'm curious if that.
No.
Not really. So this little one is, interestingly, is testing better. And there was something, this is a reused bottle. There was something else in here, which I'm kind of curious now what that was. It looks like an adrenal remedy. So these are mostly the terrain remedies. Interestingly, this bottle got split for some reason with the gallbladder ND into an Apex Energetics bottle that had some kind of, I can't quite read it, but it had, it had adrenoplex in it. So probably what I would want to do now is go back to my house and get the Apex line of Adrenoplex and Adrenopath. There's also like the Lymph Max line. So I have those lines. So it's possible that the reason she's testing well on this gallbladder ND, which is split from this bottle, is because of this bottle came originally from the Apex. It's a reused bottle, so it's possible it still has some of the energy from the old homeopathic remedy in it. That's why she's testing well on that. So it'd be interesting to see if she's testing, if I go home and get that other box of drainage remedies if she's testing well on that. Just suspicious here. But anyway, I'm probably going to be too lazy to do that because she's testing the best on the skin, right? So we'll just stick with the skin. We'll go with that and we'll put this away. But maybe next time if we do another video with Susie, I'll bring this line over because she was kind of testing well on this one. Okay. And I also here have back to a couple things. I've got her DE, which she's kind of consistently tested well on DE. So let's see where, and she's on DE right now.
Yeah.
So let's see how she's testing on that.
No.
Not really. Okay, cool. So not really on the DE. I brought two things, grapefruit seed extract and caprylic acid. I brought those to look at, the capril is more for the yeast, to see if her yeast is coming back, because the vet had suggested to switch her back onto a dog food that has some sugar in it. So I wanted to just see if she's having her yeast coming back. And she had tested well on capril and done really well on it before. And I brought grapefruit seed extract just to look at any, it's one of the most common things that I find works against bowel dysbiosis. So just to see with her diarrhea if there's any bacteria that might be in there causing, that might be testing well against the grapefruit seed extract that might be causing her diarrhea. And there's a, what is this?
It's a medication for the incontinence.
Oh, this is a medication for her incontinence. Okay, so we can, it's a prescription medication. No, Missy, you're not done. Here, let me give her a treat. Missy, you want a treat? You're not done yet. Almost. Uh-oh. Retreat. Okay. So let's just go through. She's getting impatient here. She's getting impatient, I know. So let's go through the grapefruit seed extract. No. The capril. No. And the incontinence medication.
No, that's pretty weak.
This one is weak. I didn't bring any antibiotics. It might be interesting to check an antibiotic. She's not testing well on the yeast, not testing well on the bowel. So, so the diarrhea, the biting, I would say, you know, I would hope that the skin remedy would take care of the biting and help her drain whatever it is that's causing her to itch. With the diarrhea, we didn't find anything here specifically for the diarrhea or that I think might help with that. She's not, though, testing well anymore on her parasite medication. So, and it is day 10, so I'd say it's time to take her off. And hopefully taking her off of the pyrantel will hopefully help the diarrhea. Diarrhea can be a side effect of the parasite medications, especially now that looks like she doesn't need it anymore. So I'd say, I'd guess, or I would hope that taking her off the pyrantel might help the diarrhea and that this skin might help her, her biting.